Submucosal fibrosis in achalasia patients is a rare cause of aborted peroral endoscopic myotomy procedures. Introduction. Achalasia, a neurodegenerative motility disorder, is characterized by incomplete relaxation of the lower esophageal sphincter, LES, and to some extent a lack of peristalsis of the tubular esophagus, resulting in a series of symptoms including dysphagia, regurgitation, chest pain, and weight loss. Peroral endoscopic myotomy, POEM, is an innovative endoscopic alternative to Heller myotomy for the treatment of achalasia. Since POEM was first performed in Japan in 2008, it has been adopted with enthusiasm by endoscopists around the world. The indications for POEM have expanded from patients with simple achalasia to those with advanced sigmoid esophagus, failed surgical myotomy, and previous endoscopic treatments. Over 5,000 POEMs have been performed worldwide, with limited numbers of aborted procedures formally reported. Although rare, aborted procedures represent the extreme of a continuous spectrum of technical challenges. Little is known about the incidence, causes, and sequelae of POEM technical failures, and an in-depth analysis of these cases may allow a better understanding of the procedure as well as the disease. Accordingly, the aim of this study was to analyze the incidence, causes, impact, and management of technical failures of POEM. Background and study aims. Peroral endoscopic myotomy, POEM, is now an established treatment for esophageal achalasia. The standard protocol ensures a smooth operation in most patients, but technical challenges and failures exist, and little is known about the incidence, causes, and impact of aborted procedures. Here, using a large patient cohort, we attempted to answer these questions. Patients and methods. All patients admitted for planned POEM between August 2010 and July 2015 underwent chart review. Aborted POEM was defined as the inability to finish the procedure after submucosal injection. The cause of the failure, clinical course, management, and follow-up data were analyzed. Results. 13 of the 1,693 POEMs, 0.77%, were aborted. Out of the 13 failures, 12, 92.3%, were due to severe submucosal fibrosis, which precluded tunneling, and 1, 7.7%, was due to atrial fibrillation related to the electric current of the endoscopic knife. Submucosal fibrosis, prior Heller myotomy, and age, greater than or equal to 60 years, were related to technical failure, while a disease duration of greater than or equal to 6 years, sigmoid esophagus, mucosal edema, and prior interventions were risk factors for the presence of fibrotic changes. In turn, fibrosis was correlated with a prolonged operation, longer hospital stay, more mucosal injuries, and more major perioperative adverse events. Finally, the yearly frequency of aborted POEMs decreased after the second year as operators became more experienced. Conclusions. Aborted POEM is a rare event and is largely due to the presence of submucosal fibrosis, which not only causes increased procedural difficulties, but also gives rise to major adverse events.